Hey everyone, welcome back to Vet Wisdom, the place where complex veterinary topics become crystal clear. Today, we're taking a deep breath and exploring the fascinating world of respiratory physiology in animals. Whether you're a vet student or an animal health professional, this is a must-know topic. So let's get started. Let's begin with the main job of the respiratory system. Its primary role is gas exchange, bringing oxygen into the body and removing carbon dioxide. Oxygen is essential for energy production in tissues, while carbon dioxide is a waste product that must be eliminated. This gas exchange helps maintain acid-base balance and supports normal cellular metabolism. Animals with higher metabolic rates, like small animals or athletic species like racehorses, have greater oxygen demands. Now that we know the purpose, let's understand where and how it happens. Gas exchange occurs in the alveoli, which are tiny air sacs at the end of bronchioles. Their thin walls and close contact with capillaries allow gases to diffuse easily. Oxygen diffuses from alveoli into the blood. Carbon dioxide diffuses from blood into the alveoli to be exhaled. This is the most crucial part of respiration. Once oxygen enters the bloodstream, it needs to be transported to tissues. Most of it, about 98.5%, binds to hemoglobin in red blood cells. Each hemoglobin molecule can carry 4 oxygen molecules. Only a small portion of oxygen is dissolved directly in the plasma. In healthy animals, oxygen saturation is 98% to 100%, and in venous blood, saturation is around 75%. Anemia may result in low oxygen delivery even if saturation appears normal. On the other hand, polycythemia increases oxygen carrying capacity. Let's understand how hemoglobin holds and releases oxygen. The oxyhemoglobin dissociation curve is sigmoidal, S-shaped, not linear. This shape is due to cooperative binding. The more oxygen binds, the easier it is for more to follow. Right shift occurs with high carbon dioxide, low pH, high temperature, or high 2,3-bisphosphoglycerate, promoting oxygen release to tissues. A left shift means hemoglobin holds on to oxygen more tightly, making it easier to load oxygen in the lungs. What causes this shift? Lower carbon dioxide levels, higher pH, lower body temperature, decreased levels of 2,3-bisphosphoglycerate. And here's something cool. Fetal hemoglobin also causes a left shift. That's why it has a higher affinity for oxygen, which helps the fetus pull oxygen from the mother's blood. All of this ensures that oxygen is efficiently loaded in the lungs. And then, as conditions shift in the tissues, it's released where it's needed most. Pretty smart system, right? The lungs aren't just responsible for gas exchange, they also act as a barrier against pathogens and harmful particles from the air. Because the respiratory tract is constantly exposed to the external environment, it has both innate, the first line of defense, and adaptive immunity, the targeted response, innate immunity. Pulmonary alveolar macrophages patrol the alveoli. They engulf and digest bacteria, dust, and debris, acting as the first responders. The mucociliary escalator, made of mucus and cilia lining the airways, traps particles and moves them upward toward the pharynx, where they can be swallowed or expelled. Coughing and sneezing are protective reflexes that physically remove irritants from the airways. Now moves to the adaptive immunity. The dendritic cells in the airway lining capture antigens and present them to lymphocytes, initiating a more specific immune response. This system is essential for building immunity against repeated exposure to respiratory pathogens. If the particles is larger than 5 micrometers, it gets trapped in the upper respiratory tract, which is nose and trachea, and the smaller particles, less than 5 micrometers, can reach the alveoli, making them more dangerous. This principle is used in aerosol drug delivery, where medications are designed to reach specific parts of the respiratory tract. After viral infections, animals are often more vulnerable to secondary bacterial pneumonia due to damaged defenses. In short, a healthy respiratory immune system is critical not just for breathing, but also for protecting the animal from disease. There are few clinical relevance examples. Impaired ciliary movement can lead to chronic infections such as primary ciliary dyskinesia in dogs, shipping fever in cattle, kennel cough in dogs, nasal bots in sheep. The maximum oxygen consumption during intense activity reflects aerobic capacity and is highest in athletic animals, such as racehorses. It depends on the number or efficiency of mitochondria. Carbon dioxide is a waste product of metabolism and is removed in three main forms: as bicarbonate, which is the most common form, bound to hemoglobin, and became carbaminohemoglobin and dissolved in plasma. In red blood cells, carbonic anhydrase converts carbon dioxide into carbonic acid, which dissociates into bicarbonate and hydrogen ions. Capnography, a method by which we measure end-tidal carbon dioxide, is a key tool in monitoring ventilation, especially under anesthesia. High end-tidal carbon dioxide causes hypoventilation. Peripheral capillary oxygen saturation shows oxygenation. Both are important during clinical monitoring. And that wraps up the essentials of veterinary respiratory physiology. If this helped clarify the topic, don't forget to like and subscribe to Vet Wisdom. It really supports the channel. Now it's your turn. What should we explore next? Drop your suggestions in the comments. We're here to make complex topics simple, one video at a time. Until next time, keep revising and keep learning.